Welcome to Straight Outta Health IT. Getting into health tech is rough, but here's an unfiltered dialogue of healthcare leaders and influencers covering a wide variety of issues affecting healthcare and the health tech industry. And now your host, Christopher Cuddy.
Hello, this is Christopher Cuddy, and welcome back to Straight Out of Health IT. So excited to have you guys back listening in on this week's episode. And for this week's episode, for those individuals who are thinking about launching a digital health product or in the midst of bringing a product to market, man, you've got the right guy today on the program who could provide just a tremendous amount of insight on this industry. He is a sought-after industry advisor and thought leader in this space. And I'm so happy to have him on the program. So without further ado, let me introduce Kirk Barnes, who I like to refer to as the digital health rainmaker. And let me give you a quick rundown of Kirk's background. Kirk is the co-founder and president of Transformer Med, an international sales excellence firm that combines selling skills and networking to accelerate the sales cycle of technology and innovation. Transform Med is a member of the American Medical Association Physician Innovation Network. And in 2020, Kirk was actually accepted into the Forbes Business Development Council, where he has published numerous articles and contributed to his expertise as a Forbes subscriber on sales, networking, leadership, innovation, and healthcare. He also has a background in globally commercializing physical and digital products across regulated and non-regulated industries, including several billion-dollar projects and products. Kirk's area of responsibility has encompassed leadership, business development, marketing, lobbying, and market access. Recently, Kirk served as a startup catalyst at the Advanced Technology Development Center, ATDC, which is an incubator housed at Georgia Tech. Go Jackets, my alma mater. And he has raised funds to launch its inaugural health technology program. Kirk also serves as chair for Together Health, and I definitely want to talk about that as well. It's a nationally recognized organization focused on digital health innovation. He's a board member of the Institute for Health Information Technology, board member for the R. Lee Cancer Research Foundation, member of several Georgia-based healthcare organizations, and a former board member of the International Authentication Association. Kirk holds a BA in economics from Florida A&M University. Go Rattlers. And welcome to FAMU. Yeah. And welcome to the program, Kirk. Thanks for being here.
Thanks, my man. It's great to be here. Any place you are, I know it's a good place to be. So it's great to be here.
Well, any place you are, I'm trying to be there as well. I'm just going to sit back and take notes as well. As an advisor to tech companies myself, I can always use some additional insight and learnings from an expert like yourself too. And so let's jump right into this conversation. The 30 minutes will be gone before we know it. And before we get started, though, I do want you to just take a couple of minutes and just share with the listeners a little bit about your story, your journey in this industry, what I like to call the origin story. How did you get into this industry and what's led you to your current role as the founder of Transform Med?
Yeah, so thank you. And I'll just tell you, my background, my pathway makes no sense whatsoever. If you were to ask me 10 years ago, did I have an idea I'd be here? Absolutely not. So just from the beginning, I was a business econ major from FAMU. My first gig out of college was in the consumer pharmaceutical space for a company, what is now a part of Pfizer. And so carried a bag on the consumer side and did management, then went into the biotech division at Johnson & Johnson, very technical and clinical sale dealing with oncologists and hematologists and bone marrow transplant specialists. So there kind of, got my feet wet in terms of a very clinical, detailed sale with clinicians. Also had my foray in really understanding how data works and science works to help understand, where to strategically call on the right doctors. And so from there, I had also met my first really solid mentor who convinced me to leave Johnson & Johnson and go to this little small Japanese startup pharma company that nobody heard of called Takeda Pharmaceuticals. So I was one of the first employees at Takeda. I was there so early that Takeda was on the top floor of an office building in Lincolnshire, Illinois. So, if you know where Takeda is now, global, they moved from Deerfield, the big campus, to Cambridge. Exactly. But I was there when there was just top floor of an office building. So we went from zero, no product, to $1 billion in 17 months. Wow. So it was quite a ride to be, unless with a B, $1 billion in 17 months. And so
talk about being on a fast track. Yeah.
Exactly. So I wore a lot of hats: marketing, market access, which is negotiating with insurers like Blue Cross and Cigna. And then was a sales director, worked in sales training, did a lot in terms of developing the sales organization's messaging around healthcare and managed care at that time. Then left Takeda to go work with the guy that was the VP at Nano Inc., which was a nanotechnology spinoff out of Northwestern. And so I was globally commercializing technology for two divisions there. And that was my first foray into the startup world, and it was quite a ride. Was there for 5 years. We didn't have the end that most startups would want.
Right.
That's a whole nother story.
But there's a story there too. There's a lesson learned there too.
Big story, a lot of learning there. So I was an interim CEO of a drug discovery company out of Florida State, and that's where I learned the tech transfer process of commercializing IP out of universities and into the marketplace. And then through that connection, I ended up getting introduced into ATDC, where I was a mentor, volunteered, and then they asked me to come on staff part-time, then came on staff full-time. Then we saw this cluster of healthcare companies, but there was no defined vertical.
Right.
Raising money. We launched the first vertical in healthcare, and I was the second African-American on staff at ATDC in the history of ATDC. So that was another accomplishment. And then from there, I really learned no matter what technology, whether it's healthcare or not, one of the common threads is how do you take very complicated technology that does really cool stuff and distill it down so that the people that write the checks understand how it's going to improve their life, their business, and then kind of working through that entire process. And then from there, I was a VP of a couple of digital health startups. I'm a VP with Remedy here in Atlanta. And then that also led me to launch TransferMed, which is really just accelerating how early stage innovative companies commercialize and work with corporations, VCs, federal governments, and even out of academia. That's my path. And through that, I'll just tell you, I got the scars, been through a layoff, downsizing, company closing, division elimination. So again, a lot of scars, but it's all helped me give really good perspective for where I am right now.
No, that's great. And I think that's absolutely a part of the journey. If you don't think that, these journeys don't have their own set of, successes and also learnings, I don't call them failures, but learnings. I mean, that's a part of the process as well, too. You really gain your greatest insights from those things that didn't go quite that well versus those that were successful as well, too. So again, Kirk, thanks for being on the program. And I personally watched, the work that you did at the incubator at Georgia Tech as well, specifically with companies like Remedy, and seeing where they were as a startup and now where they have grown and progressed to as being, one of the major players in the marketplace today. So I commend you on your mentoring and leadership and helping get not only that company, but many others out of that accelerator. Well, I want to jump into, really what this market is. Interesting enough, to your point earlier, I mean, this healthcare tech market is hot. It's on fire. There's a lot of energy, a lot of interest. You name it. Every major company to some degree is pouring some dollars into healthcare technology, whether you're an Amazon or a Google or an IBM or, you name it. All the major tech companies are investing in it, as well as non-technical companies. The Ubers and others are spending money into the healthcare space. And again, it's interesting, there was a report that was done by CB Insights that said that the digital health investment around the world really hit an all-time high in 2021 of $57.2 billion in funding. And it was primarily fueled by what was happening as a result of the pandemic, but there was still a lot of acceleration in the market even prior to that. It was still almost $32 billion in investment raised just the year before. You know, that being said, you know, you see all these deals, these mega mergers that are happening and these acquisitions that are happening within this space. But if you talk to many of the CIOs and technology leaders within the provider community, you know, many of them have commented that they feel like these billions of dollars have been wasted on these digital health startups. You know, many of them feel like the solutions that are being brought to market aren't necessarily meeting some of the current challenges and issues that healthcare organizations are facing, and those dollars could probably be reinvested in other, technologies or services to close some of those gaps. So I'm just curious, from your perspective, what do you feel about the market today? Is that true? That many of these technologies that are being brought to market don't have a perceived value by providers and life sciences stakeholders. And what are the solutions? I think the market should be considering making some investments in today.
Yeah, that's a loaded question.
Yeah, I know, right?
Magic answer. We'd be on a boat somewhere. We
exactly.
But I will say that healthcare and digital health is a hot thing right now. When you look across, giving a talk, and you look across, the projected growth for diagnostics, for pharma, for medical devices,
right,
for biotech, all the different areas, and then you look at digital health. The growth rate and the investment and also the utilization is, almost 2x the growth rate of all those other industries. And so I think part of that is that growth is that it's not regulated. So digital health does not have to go through most of the FDA rigors that a therapeutic or a diagnostic or a medical device does. So that's another reason why there's more investors that want to put money into that portion of healthcare, because they don't have the appetite to stomach going through an FDA approval or denial, depending upon what the studies dictate. I think the other thing another thing that's contributing to a lot of the innovation is I think people have a lot of ideas and from their own personal experience,
right.
And I think there's also again, lower barriers to entry to get into the digital health space. But what usually starts to separate those ideas that have a valid marketplace versus those that just are good is, one, have they really done customer discovery, which is the foundation of really launching a startup,
right.
And talk to patients, talk to doctors, talk to hospital administrators, talk to payers, and really understand the dynamics of what it means to implement something new in healthcare. You think providers and doctors spend years going to medical school. They make decisions based upon evidence-based literature. So when you think about a doctor that's been practicing for 15 years and the likelihood that they're just going to automatically adopt the newest shiny thing without having some long-term or at least some kind of data, because that's how they're trained to trust the data and the science, it's very difficult for the adoption to take place. And so that's also part of the complexity of selling in healthcare, because there's multiple decision makers. This is one of the industries where the user isn't the payer.
Right.
Right. So you're a patient and you get a drug, you get a medical device, you go see the doctor. You are the user or the end consumer, but you ultimately pay a portion of your bill, but your insurance takes care of it. So there's complexity in the payment process. And then the other party, if you think about a new digital health solution. So let's say it's a digital health solution for, let's pick on diabetes, for example. So there's the patient that would need to use it or benefit from it, because this is ultimately what all these tools are geared towards. Sometimes it's not the doctor that actually teaches the patient how to use that tool. So there's the people that actually interface with the tool. So when I was in pharma, for example, I sold it an injectable, right? Like an insulin or something like that, or GLP-1,
right,
which is a drug for diabetes. So it's sometimes the nurse practitioner, the medical assistant that spends time with the patient to train them on how to use the device, even though it's the doctor that prescribes it, it's the insurer that pays for it. There's a lot of complexities even around that. And then, Chris, like your background, and then you throw in, oh, by the way, CIOs have they're the new kings on the hill, because with the pandemic and the explosion of virtual care, the CIOs have to worry about the security and the site, protecting the entire, digital bandwidth of an entire health system and everything that goes in and everything that goes out. So I now understand why most CIOs say no from the very beginning, unless there's a proven pathway to implementing this platform into an electronic medical record. But then again, if you have something that's a freestanding software and you're expecting a doctor to use it, in spite of how good it is, just have that conversation. Say, hey, doc, I got this great digital health tool. It doesn't work with your EMR. You got to log into a different system and pull this on your phone or in a different browser while you're in the patient chart.
Right.
And you're going to doctor. So the IT component, the clinical component, the payer component, the user, the patient, and then the provider, right? All of those things have to align in order for a digital health tool to move forward. So that's another reason why people may think that it's a lot of waste. It just takes time for all of that to align across all these different tools that are bringing to market. Some of the back-end things that I refer to more as health IT that are like revenue cycle management or just efficiency and optimization that aren't provider and patient facing. Those things can move pretty quickly, like AI that's used to analyze claims data for fraud.
Right.
That stuff is cool, great, but it's not under the same lens of complexity like a digital health patient provider facing tool.
Exactly.
That's my whole box. I'm stick to it.
Oh, no, I think that's great insights. There's no, I don't think there's a magic bullet to it at all. To your point, healthcare is a very complex, multifaceted, industry that has a lot of stakeholders in it. And to your point, these technologies have to make the delivery of care much more efficient and easier and reduce some of that cognitive workload that the clinicians are experiencing by using these monolithic platforms today. How do you introduce technologies that don't, create more complexity and more frustration, but actually reduces that and provides information that's valuable for them to do what they do best, which is to take care of the patients. That being said, do you find in your interaction with some of the startups that you're working with and then the healthcare organizations and life sciences organizations you're working with, do you feel like they're receptive now to the technology? Because, it was my experience when I like to say I'm a reformed CIO, but when I was, the CIO actively, years ago, introducing these technologies into a healthcare environment was a challenge. I mean, there was a lot of change management that had to take place to get clinicians to adopt these solutions, especially things like an electronic health record system. Fast forward, a decade now that we're engrossed into the use of these platforms. Do you find that they're more receptive to it, or do you still see that there's a resistance to the adoption of these technologies? What's your sense of what the market feelings are today?
So I think it, in the true sales and marketing answer, it depends. I think there's a wide interest in exploring digital health options. I know the pandemic accelerated the pace at which health systems have an appetite for digital tools because we had to, right? That was just, we were kind of thrown in there. But now that we're somewhat out of crisis mode, I think there's what I see across health systems and even some of the industry partners is a more methodical and strategic evaluation of how digital health tools are going to be implemented and prioritized across different parts of the organization.
Sure.
I think they're also expressing a desire for platforms that have multiple use cases across the entire system. I think the days of a health system, small or large, having one tool for diabetes, one for heart failure, one for sepsis or whatever the case may be. They want to look at tools that have multiple use cases across as much of the health system as possible. And then you start thinking about the clinical champion who's going to help drive this through.
Exactly.
And then you also think about the financial impact of, in a simplest form, thinking about the triple or quadruple aim of healthcare. It's just going to, decrease costs, increase revenue, improve patient engagement, help our providers, lessen their burden so they, can hopefully mitigate provider burnout, and all those things will probably need to drive or support the transition from fee-for-service to value-based care. Exactly. So I think there's a much more holistic look at this shiny new thing, digital tool. They're open to it, but there's a much more stringent diligence that's done to really evaluate how a group of those tools are going to fit into the kind of the approach for those different therapeutic initiatives.
No, I think that makes sense. I truly believe they've become much more savvier about the use of technology. And to some degree, there is an insatiable appetite for it, but it has to be smart. It has to provide value. It has to not increase, frustration for the end user, and ultimately, meet the quadruple aim goals in the adoption of that technology as well.
I'll give you a real quick.
Yeah,
so, remote patient monitoring is a hot thing right now.
Right.
And so during the pandemic, CMS in 2019, expanded the reimbursement of CPT codes for RPM. Mm-hmm. Great for patients, increases engagement, especially for those with chronic diseases. They've expanded upon it. A lot of people hopped in to RPM because it's the new thing.
Right.
But executing an RPM program effectively so that patients use the devices appropriately.
That's right.
You have enough staff to really administer and run the RPM program, mm-hmm. and then ensuring that you have all of the tools in place to hit the metrics you need to get reimbursed. That people figured out, it's not as easy as I thought. And even the solution providers recognize it's a lot to even make sure that you're providing a commensurate amount of support for the provider practices and hospitals that want to do it. And even people are getting out of the RPM game. You have providers that even FQHCs, federally qualified health systems, that got some of these grants, like from HRSA or FCC,
sure.
To do remote monitoring. A lot of money. They were like, this is great, but we don't have the staff to hit the metrics that are needed to accept this grant money to do RPM, which we want to do, so we're going to decline. So that's another example of, digital health tool plus connected devices and reimbursement. So money really isn't the thing. The CFOs would like it, but the devil's in the details, and what does it take to execute it across all those different layers. But RPM is a really good example that some people now just aren't doing it. Primary care doctors like it, but they don't have the staff.
I think that's a great example. When you look at technology, it's not implementing technology for technology's sake, but making sure you have the people, the processes, and the technology all aligned so that you can maximize the investment in that solution. And so, to your point, RPM has no real value if you don't have a chronic care management component on the back end to manage that patient's situation and then capture all the necessary data you need to then submit for reimbursement for those services as well too. So that's a great example. I wanted to kind of shift a little bit back to the entrepreneur and those individuals who are making an investment in bringing technologies to the market. Can you share from your perspective some common pitfalls that typically entrepreneurs face that compromise their ability to be successful in the healthcare and life sciences marketplace?
I think two things, and I love this question. The first thing is understanding the patient.
Right.
And understanding. So, for example, many people that create digital health tools, whether they say it proactively or implicitly, many times that product is geared towards one of two patient populations. It's either geared toward the commercially insured patient or a Medicare patient.
Right.
So if you think of a Bluetooth device that sounds great and we're going to sell it to, a lot of your practices, but you don't understand their patient demographic. Mm-hmm. So if the patient demographic is a payer mix, as they'll call it, is 30% Medicare, 30% commercial, 30% Medicaid, and you're selling this Bluetooth device with software that the patients are going to download the app, you have to understand, what does a Medicare patient look like?
Right.
Where's the profile? Do they use cell phones? Do they use apps? Mm-hmm. Are they tech savvy? Right.
Exactly.
So that's one of the things I think that is often missing when entrepreneurs that haven't been in healthcare and really understand it. You've not been in healthcare, we're still figuring it out.
Right.
But I think understanding the patient's perspective, and a good place to start is understanding the payer mix of the people that you're selling to, or understanding that if your patient is between 25 and 50, know that that's probably a commercially insured patient that probably has a job. They get their insurance through their company, and they probably have the means to pay out of pocket if something's not on formulary, or if they have to pay $150 out of pocket.
Exactly.
Right. Those are the things you got to know. But if it's a Medicaid population and you're selling them some kind of app, do you recognize that Medicaid patients may not have bandwidth?
Right.
They may not have Wi-Fi, or if it's a rural population.
That's right.
Or understanding that there's opportunities in rural health and underserved populations.
Right.
But you have to understand the patient and the people that treat those patients, and create your value proposition so that it aligns with their needs and what they want. I think that's probably a fundamental piece that's missing in a lot of early stage digital healthcare companies, and not really understanding. Like, you ask some people, what's the difference between Medicare and Medicaid, and they can't tell you.
Sure.
That's an example of the problem right there. And the last thing on that, understanding what's happening with the demographic shift in America. Mm-hmm. The fastest growing patient population, Medicare, and cash pay or self-insured, because of the growing gig economy, the Great Resignation, the aging of the baby boomers. In 2022 is a peak year that baby boomers are off the chart. So do you understand what those patients need, what they look like, who treats them, those things. So I think that's all the technical stuff. They can figure that out, but this is the key part that many will fail at as they're trying to launch and move their business forward.
That makes sense. The other thing I would share too is for individuals or organizations interested in coming into this space is understand that these products and technologies are going to be used to treat patients. They will have an impact on someone's life. Are you prepared to take on the same responsibility as that doctor and that nurse and that healthcare provider in using that technology to treat that patient? If you're in this just for the money, then you're not in this. You should not be in this industry, because this industry is all about treating and taking care of your fellow man. And if you don't fundamentally believe that as the foundation of why you're here, then you shouldn't be in this industry at all as well.
Amen to that. And the docs and the administrators, they can see it a mile away.
That's right. They can smell it out. And to your point, if you don't understand basic logo and the terms and technologies in this space, they'll sniff you out and they'll put up what I call the vendor kryptonite, and you will not be able to, be successful in this market. I did want to turn our attention, because, the time is running quickly on us, and I did want to give you a chance. I know I'm going to have to have you back on the program.
Anytime.
I did want to give you a chance to talk a little bit about Together Health as well, too. And so maybe you can spend a few minutes on that. And then I want to wrap up with some practical advice that you can give, entrepreneurs and startups in this industry. So let's start with Together Health, and then we'll wrap up with the advice.
Great. Together Health was the initial thought and concept developed by Stefan Konya, who's a senior advisor to the deputy for the National Office of Health IT, or ONC, which is a less known 3-letter acronym that falls under HHS. But the goal for Together Health was to really coalesce people across different ecosystems in the country to come together and think about how can we remove barriers to digital health adoption and accelerate its adoption. And so with the growth of Together Health, I'm now the second round of co-chairs. So myself, Stefan, and Rachel Dixon, who's the CEO of Prime Health in Colorado. We have over 50 plus ecosystems represented, from Cedars-Sinai to Mass Challenge to Texas Medical Center to the American Medical Association, and even HIMSS. HIMSS and also Health, HLTH, are part of Together Health. And we are a force multiplier for all things digital health. And even we can pretty well predict which digital health startups are going to be able to navigate a health system correctly, because we talk, we meet, we understand what is going on in our respective ecosystems. And we currently have 3 key subcommittees. One is around health equity that is being driven by the AMA, American Medical Association, Meg Barron, my good friend, and Olivia at Matter, based out of Chicago. We have another project called the TESSA, the Together Health Security Assessment, which is trying to get CIOs to create a standardized BAA or security assessment that would pass the muster for about 80% of hospitals.
Exactly.
So we're working on a project. And then the third one, we're working with Scale Health in LA on a live ecosystem map that would be able to provide people kind of a real-time view in what's happening across the United States for digital health. So if you wanted to see which health systems are implementing or using a digital mental health application of some sort, we would be able to show you that in our ecosystem map project.
So what's the value of me as an entrepreneur getting affiliated or tied into Together Health? Single
point of entry, access to the leaders of digital health innovation across the country. We also have VCs that are part of Health Venture. HealthX Ventures is another venture fund that's a part of Together Health. We have hospital systems, accelerators, incubators. So if you're looking for a single point of entry to access all of this across the country, we are it.
Sounds great. So let's talk to the folks who are out there, waking up every morning trying to get that product to market, or in the market today, and maybe dealing with the challenges of healthcare, because it's a tough industry. Well, what's some practical advice you can give to those emerging healthcare technology companies, or those people who are sitting at listening to this podcast right now and trying to make a decision? I've got an idea, I want to launch it. I'm not sure if I can do it or what it would take to do it. Your thoughts and perspective on this market, and some practical advice you would share with them.
I would say one of the first things is read The Lean Startup by Mark Rice, and get an understanding of what customer discovery is before you spend any money on a developer, a MVP, beta project, or whatever. Go talk to people, especially if you don't understand healthcare. Get connected into a local incubator or healthcare technology program. Wherever you are, you can hit me up. You can share, Chris, share my information. But I think don't go at it alone. Find people that are experts and will help you. And lastly, do your homework and really research who else is doing something in the same ballpark. Not saying that will, deter you from moving forward, but get an understanding of what competition is out there. And then I lied, there's one last thing. As you build a team, be conscious of the technical person, the scientific person, the medical people, and the business people.
That's great advice.
You need all of them.
Absolutely. Great advice. Okay. Well, again, we've got about 2 minutes left in this episode. And again, I want to have you back because there's so many more questions I want to ask you as well, too. But I'm going to do kind of my rapid fire round to wrap this up as well, too. So the first question I have in a rapid fire round is, when you're not out there creating the next multi-billion-dollar healthcare company, what do you do to relax? What's your hobbies, passions?
Golf and listening to music.
And do you have a favorite genre of music?
All.
Yeah, listen to it all. Okay, that's good stuff.
Yeah, exactly.
Cool. Name one thing on your bucket list that you've done so far.
Saw the Great Wall of China.
Oh, that's great. That was on my bucket list.
On my birthday. That was big.
Oh, wow. That's great. Name one thing on your bucket list you haven't done yet.
Seeing the Great Pyramids of Giza.
Okay. Yeah, that was on my list too. I've not done either yet. Let's see. What was your favorite television show as a kid?
Oh, goodness gracious. It wasn't, that's a good one. I will say the Bugs Bunny Roadrunner show. I love it. They had the Bugs Bunny and then all the other cartoons off of that. So I spent a lot of time with them. Exactly. Yeah. And you just mentioned a book that you would recommend folks reading. Is there another piece of literature you would recommend for anyone, whether you're an entrepreneur or non-entrepreneur? Ooh, that's a good question. Of course, I'm drawing a blank. I think any book that helps you understand people better.
Okay.
So things that will help you understand, like things like DISC or Myers-Briggs or stress challenge. I think anything that helps you better understand how to talk to other people will universally help you in healthcare, in business, how to pitch, how to connect with people. So I don't have one that necessarily comes to mind right now.
No, that sounds good. That's fine. Well, Kirk, again, thank you so much for taking time out your busy schedule to share your insights on what's happening in industry and provide some practical advice to entrepreneurs who are interested in bringing solutions to the market. We're so glad to have you on the program. We'll definitely have you back for further discussion. And thank you, everyone, for taking time out your schedules to participate in this program. Look forward to seeing you on the next episode. And you can find us on any of the latest podcast platforms. Thanks again for participating. Have a great day. Well, it's a wrap. Another thought-provoking episode of Straight Out of Health IT is in the books. I want to thank you again, Kirk Barnes, for joining me today and providing your perspective on the pitfalls and challenges that startups have in penetrating the healthcare IT market and providing value to that market as well. So thank you so much for being a part of the program. Thank you, everyone, for taking time out of your busy schedule to stop in and listen to our conversation. As always, your feedback and support is always appreciated. Let's make this episode go viral. And again, please share it with your colleagues and friends. We are on all the major podcast platforms, so you can find us there. Just search for Straight Out of Health IT. Thanks again. Look forward to seeing you on the next episode. Take care. God bless. One love.
Thank you so much for listening to Straight Outta Health IT. We hope you enjoyed today's guest. For more unfiltered dialogue of healthcare leaders and influencers, be sure to tune in next week. For the show notes, transcripts, and resources, please visit Apple Podcasts, Spotify, or your favorite streaming platform. We invite you to give us feedback by reaching out to Christopher Cuddy on LinkedIn, just searching for Straight Outta Health IT, and you'll find us. We are constantly having live discussions about diverse topics in the industry.